Orange County, California. As a top tourist destination, the OC is well known for its beautiful beaches, thrilling amusement parks, and high-end fashion retailers. Sitting among the top 3% of the wealthiest counties in America, Orange County gives the appearance of a carefree lifestyle where money comes easily. What many people don't realize is that Orange County has an extremely high homeless rate, and among the homeless, diseases like diabetes are becoming a bigger problem each year. This film will introduce 5 individuals who are currently in the fight against diabetes among the homeless. Through their experience, they're able to paint an accurate picture of the real problem of diabetes among the homeless in Orange County. With diabetes affecting more and more of the homeless population every year, hundreds of patients without health insurance rely on volunteer doctors and nurses to provide care. With their extensive experience, these professionals may be able to give the best depiction of the problem at hand.
I'm Michael Pervengi. I'm one of the faculty members here at the residency training program for Kaiser Permanente and Tustin Santa Ana. I've been working with the homeless probably for the last, I would say, 5 to 6 years. I was fortunate enough to be the recipient for the Young Physicians Community Service Award for the American Medical Association. It represented not my efforts, but the efforts of all of our providers and the residency program, and really it was a statement about how far we've come in terms of being able to support the community and our diabetic population and other groups. Diabetes and high blood pressure are by far the 2 most common things that we see, and I would say of the ones that I treat, probably a good 15, probably 10 to 15% of them do have diabetes. The single most challenging thing is getting those medications refilled and being able to continue them to adhere to their medications. That's really the key. If you look at any medical illness, the main thing that's of importance is to continue the medications and try not to have periods where you're off the medication. If you had one thing to recommend to people, whether it be education or proper exercise or eating healthy or taking their medications, usually the single most important thing is to get those medications and take them every single day. And that's the challenge. It's rather surprising to find out where the greatest needs are. Much of our time was spent in South Orange County, which is not the place that you'd expect, in San Clemente or Laguna Hills or places like that, but this is where a lot of the homeless reside. One of my biggest observations when I first started going out to the mobile units was that the homeless population, as I had imagined it, was very different from what I actually saw. Young families with young children. These are not the people that I expected to find in this situation. If we can get people on medications and get them into regular checkups, perhaps we can keep these folks out of the hospital and keep them healthy and prevent illness as well. We're scientists at heart, and we like to know that what we're doing is having an impact on the community. I can tell you both from a subjective as well as an objective point of view that our efforts definitely have made a difference.
Organizing the efforts of volunteer doctors and nurses is often done through nonprofit organizations. Treatment centers like the Lestenac Free Clinic provide free health care to the homeless through the help of government funding and donations from the public.
Hi, my name is Ed Gerber, and I'm the Executive Director of Lestenac Free Clinic. Lestenac Free Clinic started 30 years ago as a response to the need for health care in Orange County. Probably about 60% of the patients coming into the clinic suffer from diabetes. Typically it's type 2 diabetes, the onset in later ages. And it's become a problem here in Orange County because of the lack of affordable health care for them to be able to come and get treatment for their diabetes. Probably the 2 most successful programs that we offer is first and foremost our Bridge to Care Clinic, which is a walk-in clinic for anybody in Orange County that doesn't have insurance. So if a patient thinks they have diabetes or has symptoms where they're concerned about diabetes, they have a place they can go and get blood tests and actually get put on medication to help control their diabetes. we've developed a program that partners with the primary care doctor as well as an education person so that they communicate back and forth and express the need to the individual on what they need to do to control their problem or control their disease. So we're able to help people identify the problem, identify ways by which they can take steps to manage their disease, as well as getting the medical advice and medical treatment to help them manage their disease. My hat goes off to all the volunteer doctors that provide on a regular basis services to here at the clinic. So more can be done, but again, funding is the issue. We've opened 4 community clinics throughout Orange County. We have the ability to go doing more, but funding, unfortunately, is always the issue that gets in the way.
While brick-and-mortar clinics provide tremendous support to homeless diabetics, other nonprofits like the Illumination Foundation use alternative routes to reach their patients.
I'm Paul Leon. I'm the CEO and President of the Illumination Foundation. In the United States right now, our average life expectancy is 82. In the homeless arena, it's 50. That's 30 years difference because of dietary problems and also stress and environments. We're starting to see a lot of type 2 diabetes within our families. The medications for diabetic maintenance is extremely expensive, and most of the families that we take care of, they may be able to afford the glucose monitor, but they can't afford the strips. If they can do regular testing, they may not be able to afford the diet that has to go with the whole program. Probably our biggest challenge is to be able to put all of the components of care that's required to this population. We started about 3 years ago in the armories doing mobile medical care, and we're one of the 3 or 4 mobile clinics that go out into the community. We go to where we find most of the homeless congregate, and of course we do diabetes testing. The benefits from the mobile vans is you can get it out quickly. You can take it into neighborhoods where, low brick and mortar clinics are. Obviously, you're targeting a population that has extremely limited mobility, so we go to them. One, they trust you a little more because you're coming into their backyard. 2, once they're identified and you have that population, their whereabouts, you can follow up just like you would any other patient.
The Illumination Foundation isn't the only organization delivering portable health care to the homeless. Other mobile health clinics are on the move every day in Orange County to seek out those in need.
My name is Marissa Wade. I'm a physician assistant, and I work with the Orange County Rescue Mission. We have a motorhome that goes out into the community to serve the homeless, those that are uninsured. We can provide them with some meds. If we have insulin and if we have the oral meds, we give them for free. We can check their sugar when they come. It comes to them. A lot of them are also that the big limitation is that they don't have a means to get around. So to even get to our office, they're unable. It's too far, or to other offices that are free. So motor transportation is not there. So coming to them is significant. The insulin pens is a new novelty, and it's great for the homeless population, and if they're drug using, you're not using a syringe. You just have a pen needle, and so they can't do anything with that. It's all together, it's plastic, it doesn't break. The biggest struggle is, and the only way we can know how the medicine's working is them checking their blood sugars. And you need a meter and the test strips. So it's very costly. The meter's not too costly. It's $10. There's one at Walmart. We put everybody on that one. The test strips are $25 per 50 test strips. My true homeless patients that have no money, no income, there's absolutely no way they can do that.
Government aid is a crucial part of nonprofit organizations helping homeless diabetics, and with the current economic crisis in California, many questions have been raised on whether this funding can continue.
Hi, I'm Congresswoman Loretta Sanchez. I represent the central portion of Orange County in the U.S. House of Representatives. And I work on a lot of issues, including I sit on the Armed Services Committee, on Homeland Security, and also on the Joint Economic Committee. We actually do have a higher number per capita of homeless here in Orange County than in many other areas in the United States. Orange County is known as one of those, I did it myself, pull yourself up by the bootstrap type of a community. And so it's actually on the area of charity and giving, one of the lowest on the list of areas across the nation. This type of a disease does require that someone have stability as a place to store their supplies. Housing prices are very high in California, especially here in Orange County, so it's difficult to afford a place to live. It really requires vigilance with respect to the disease. And when you're homeless, it's very difficult to do that. One of the things that we tried to do, especially under the new healthcare reform law, was to provide more clinics, for example, in very local neighborhoods where we might find some of these people. And that might be one of the solutions. If we're able to build more access to healthcare, then we wouldn't have diabetics going into emergency rooms to get the insulin that they need, which is the highest cost area, highest cost point for our healthcare system. The delivery of healthcare is done at a very local and state level. And the federal government, in a lot of ways, isn't involved with respect to healthcare. We are in the sense that we have the Medicare program. We are in the sense that we have the Veterans Care Program. Those are government programs. But the reality is most of the delivery of healthcare services is done by a state. So when a state like California is doing very badly, that means it's cutting back on everything. It certainly is cutting back on all the healthcare facilities, and the money's going into that. That's one of the reasons why we took up healthcare reform in Congress, because we realized that too many people were falling through the cracks. Usually if a person is homeless, especially here in Orange County, over half of them are women with children, and the other half tend to be veterans. So we want to really try to help them.
Without proper funding, homeless diabetics who cannot afford their medication will have a grim future. But you can help. Please visit these websites and donate today. Even a small amount can help someone in need.